Hello everyone. In this session, we are going to discuss a very important topic, that is glomerulonephritis, its pathogenesis and classification. In your university exam, you usually get a long question on the pathogenesis and a short question on classification. Now, after this video, there is another video of primary glomerulonephritis in which I have individually discussed all important 9 types of glomerulonephritis. Trust me, you can't understand any type of glomerulonephritis if you don't understand the basics. That is the pathogenesis of glomerulonephritis. So I request all my dear students to first watch this session, understand the pathogenesis of glomerulonephritis, then move on detailed individual glomerulonephritis. So let's start it. Glomerulonephritis, its pathogenesis and classification. So first of all, I will let you know the pathogenesis of glomerulonephritis. I will be discussing 3 important pathogenesis: antibody mediated pathogenesis, cell mediated injury, and alternate complement pathway mediated injury. Then we will discuss the location of the deposits, and then finally we will see the classification of the glomerulonephritis. So let's start it. First of all, before moving to the pathogenesis of glomerulonephritis, we will quickly revise the anatomy and histology of the kidney. Then only you can understand it well. So you can see humans have a pair of kidney. Can you see? Humans have a pair of kidney. Inside each kidney, there is 1 million nephron. Nephron is the structural and functional unit of the kidney. Each kidney contains 1 million nephrons. So there are 2 million nephron in the kidneys. Now, what are the parts of the nephron? Nephron have 5 parts. There is Bowman's capsule. This is Bowman's capsule. This is proximal convoluted tubule, that is PCT. This is loop of Henle, that is LH. This is distal convoluted tubule, that is DCT. And finally, this one is collecting duct or collecting tubules. Currently, I am teaching you the topic glomerulonephritis. So I am interested in glomerulus. What is glomerulus? You can see. Now see the glomerulus. Glomerulus have 2 things. Glomerulus have 2 things. What are the 2 things? There is the Bowman's capsule, and Bowman's capsule contain the tuft of capillary in that. Can you see the 2 capillaries? This is the afferent arteriole. This is afferent arteriole coming inside the Bowman's capsule. There is a Bowman's capsule. The afferent arteriole is coming inside that, forming a tuft of capillary and leaving out as efferent arteriole. It leaves out as efferent arteriole. So first afferent arteriole is coming, forming a tuft of capillary and leaving out as efferent arteriole. This structure, the Bowman's capsule along with the tuft of capillary inside that is known as glomerulus. So glomerulus have 2 things. Number 1, Bowman's capsule, and number 2, the tuft of capillary. They together known as glomerulus. So you can see the diagram of glomerulus. You cannot understand glomerulonephritis if you don't understand the glomerulus. So first understand the structure of the glomerulus. Here you can see this is afferent arteriole. This is efferent arteriole, and you can see the capsule, the Bowman's capsule. This is Bowman's capsule. Appreciate the Bowman's capsule. Appreciate the Bowman's capsule. This is Bowman's capsule. So afferent arteriole is coming inside the Bowman's capsule, forming a tuft of capillary and leaving out as efferent arteriole. Now, whatever substances which are supposed to be excreted, they are coming here. They are present in the efferent arteriole. They are present in the capillary. They get filtered out from here. They get filtered out, and the remaining which are not supposed to get excreted, they will go in the efferent arteriole. So from the capillary, whatever substances which are supposed to get excreted, they get filtered over here and collected over here, and they will be excreted as urine. This is known as glomerular filtration. You can see the same here. So here, whatever substances which are supposed to get excreted, they get filtered from here. In the Bowman's capsule, they get filtered. You want to see? Let's see in the video. You can see this the same in the video. So whatever substances which are supposed to get excreted, they get filtered from here. So they come from the blood to the Bowman's space. So from where to where they are coming? From the blood. They are coming to the Bowman's space. They are getting filtered from here. So the same you can see. Can you see it? It is not only one capillary. For understanding, I have drawn one, but there is a tuft of capillary. So appreciate the tuft of capillaries here. Can you see from all these capillaries, the substances which are supposed to get excreted, they get filtered out and they are accumulating in the Bowman's space. Now, let me tell you something. So imagine here is the substance. This substance want to get filtered. Okay, this want to get excreted. So it will cross this barrier and it will come from blood to the urine. So there is a barrier to be crossed. Can you tell me the name of the barrier? What are the layers in that barrier? In that barrier, there are 3 layers. What are the 3 layers in that barrier? Number one, the capillary. This is the capillary. Now the capillary is lined by the endothelium. So you can see the endothelial lining of the capillary. Number 1. Capillaries have a basement membrane. So this is the basement membrane. Let me show you the basement membrane of the capillary.